Greetings from Weill Cornell Medicine in Qatar. Um, my name is Ravi Mamtani, and I'm a professor and vice dean at Weill Cornell Medicine in Qatar. And I just want to say thank you to everyone for taking the time to be with us this afternoon, this evening. Um, and join our series, specifically Population Health and Wellbeing Educational Series. I'd like to go through some information, including some housekeeping notes. A reminder that the objectives of our series are threefold. One, discuss contemporary and critical topics relevant to healthcare, medicine, and population health. Number two, examine evidence-based practices germane to public health and patient care. And three, describe opportunities and challenges in the evolving phase of healthcare and population health. And as I said, a couple of housekeeping notes. Your cameras and microphones are turned off. Use the Q&A feature to type questions and any comments that you may have. And finally, of course, the questions will be addressed at the end of the session. A reminder that this activity is accredited. It is accredited by the ACCME in the US, and also by Continuing Education Department of the Department of Healthcare and Professions at the Ministry of Public Health in Qatar. Insofar as evaluation and certificates are concerned, the post-activity evaluation will be available in your Cloud CME account by January the 23rd, 2025. Healthcare practitioners licensed in Qatar will only receive their credits once the QID and MOPH, Ministry of Public Health license number, are provided. You will receive an email notification once the evaluation is available in your Cloud CME, and your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. Now on to today's discussion. The topic for today's discussion is burnout in healthcare workers, a lifestyle medicine perspective. And we are so honored and so privileged that we have a great physician, namely Dr. Sunil Kumar, engaging in a discussion on the topic. So just a brief introduction on Dr. Sunil Kumar. Dr. Kumar is a board-certified lifestyle medicine physician, a health coach, and also a specialist anesthesiologist in the National Health Service in the United Kingdom. He holds a medical degree from India, membership from the Royal College of Anesthesiologists, and also fellowships from the British Society of Lifestyle Medicine, College of Anesthetists, and Royal Society of Arts in the United Kingdom. He's also a diplomat of the International Board of Lifestyle Medicine, where he also serves on the examination faculty. As an international speaker, he's absolutely fantastic, and you'll hear him in a few minutes. As an international speaker and author, Dr. Kumar has contributed to books, several chapters in the books, including an Oxford University publication. Dr. Kumar is also part of the international faculty for the Masters in Lifestyle Medicine program in Greece. His expertise spans lifestyle medicine, physician self-care, anesthesiology, and prehabilitation. So you can imagine just how wonderful he is and in terms of his knowledge and skills in these fields. Integrating comprehensive medical knowledge with holistic approaches to improve patient outcomes is his overall objective, and that's what he's been doing for the past few years. He's also a faculty facilitator of health and well-being workshops for the National Health Service in England. So, Sunil, if I may call you with that name, It's a privilege to have you with us, and I want to personally thank you. And on behalf of the IPH at Cornell in Qatar, we are grateful that you're able to take time out of your busy schedule to be with us this evening. So, with that, over to you, Sunil. Thank
Yeah,
you so much.
thank you. Thank you, Dr. Mamtani, for a kind introduction and such kind and generous appreciation as well. And it's my honor to be here, and it's honor to accept your invitation to come and present to you all. Okay, so good afternoon, everyone. It's still good afternoon in Qatar, I guess, and here it is good afternoon as well in UK. And it's my pleasure to be here today to talk about a topic that is critically important for the well-being of healthcare workers, which is burnout. So, obviously, being a lifestyle medicine physician and a health coach, I have seen firsthand how burnout affects healthcare professionals and how lifestyle interventions can be powerful tools for prevention and recovery. So, over the next 45 minutes or so, we will explore what burnout is and how it manifests in healthcare workers and practical strategies to prevent and manage it through lifestyle medicine principles. So I have no financial or non-financial disclosures related to this topic. Additionally, I will not be discussing any off-label or unapproved use of drugs or products. So before we dive into the session, let's take a moment to outline what we aim to achieve today. So burnout, especially in healthcare professionals, is a growing concern globally. And my goal is to not only help you understand burnout, but also to empower you with some practical tools to address it as well, both in your personal life as well as in your workplace. Now, burnout is not just a feeling tired, it's deeper state of three important domains: physical, emotional, and mental. You get exhausted in all these three domains. And we will discuss what it looks like, how it progresses, and when to take action. Our daily habits, like what we eat, how good we are in physical activity, sleep, stress management, and even social connections, they play a crucial role in either preventing or even exacerbating burnout. So we'll explore this also in depth. It's not just about identifying burnout, it's about taking action. So we will look at research-backed interventions, including self-care strategies and workplace changes that can make a real difference. By the end of this session, you should have a clear, actionable plan for improving your well-being. And whether you are an individual looking to protect yourself or a leader wanting to create a healthier workplace, this will give you a roadmap, hopefully. And so let's begin by first in understanding what burnout really is and why it is particularly prevalent in healthcare professionals. Now, if you look at the number of PubMed search hits for the term burnout, it has significantly increased between 1970 and up till 2019. Obviously, if you trace it further to 2024, you'll still see growing interest. It does reflect growing interest and research in this area. So in 1970, almost there was zero hits, and in 2019, about 2,000 plus hits. So this trend highlights the rising awareness of burnout as a critical issue, particularly in healthcare and workplace settings. This is driving the increased academic as well as clinical research. And then burnout, what burnout is? It is a work-related stress syndrome. Um, it's a work-related stress syndrome resulting from chronic exposure to job stress. So remember these words, they're very specific. They're work-related stress syndrome. So it has to be occupationally instigated as well as it's a syndrome. It's not about just a psychological term. So this term was actually introduced in the early 1970s by psychoanalyst Freudenberger and has subsequently been defined by Maslach et al. As a consisting of three qualitative dimensions, which are emotional exhaustion, cynicism, and depersonalization, reduced professional efficacy, and personal accomplishment as well. So burnout can occur in any kind of profession, but it is much more common in healthcare professions like ours, where we constantly care for others. So we may feel emotionally drained, overwhelmed, and unable to meet the demands of our job. This is why it's so important for us to recognize burnout early and take action. Now, healthcare workers and especially perioperative clinicians seem to be at particular risk for burnout, including A&E doctors and the GPs and family doctors, as you call that. So you can see how rampant it is in different specialties as well. Now, WHO actually has recognized this burnout as a ICD-11 definition with this as a syndrome. Again, looking at the terms, you always remember there are three dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism, and a reduced professional efficacy. These three are very important. Much more important to that is it specifically to the phenomena which is due to occupational exposure and should not be applied to describe experiences in other areas of life. For example, if my daughters, when they're studying for the exam, they say, oh, I am burnt out now, but it is not. Actually, it's not related to something. It is, you might be tired, you might be stressed, you might be exhausted, but you're not actually burnt out if it is not occupation related. So the symptomatology of burnout appears to be rather complex, as the syndrome seems to develop in several consecutive stages. So initially, Freudenberger described development in 12 different stages. Again, it was clinically difficult for us for research or for clinical. For that reason, it was very difficult to follow those all 12 stages. Later on, this model has been simplified, and currently a 5-stage model is most frequently used. Now, this 5-stage model starts with the honeymoon phase and is characterized by enthusiasm. However, inevitably after time, this becomes associated with experiencing the stresses of the job. If at this stage there is no positive coping strategies are implemented, the process of burnout risks become initiated. So this is followed by the stage of stagnation, also called as the onset of stress. And this second stage begins with an awareness of some days being more difficult than others. So life becomes limited to work, and taking care of business, family, social life, and personal priorities are neglected. Now, then a stage of chronic stress develops, which leads to frustration. The individuals get the feeling of failure or a sense of powerlessness as well. That efforts do not visibly pay off, and the impression in or fact of not receiving enough acknowledgement leads to one feeling incompetent and inadequate. So that's what stage 3. Then this leads to stage 4, where a stage of apathy, or you can call real burnout stage, where despair and disillusionment can occur. People do not see a way out of the situation and become resigned and indifferent at this stage. Then the final stage is habitual burnout. Symptoms of burnout cause a significant physical or emotional problem, and ultimately this may prompt one to look for help and intervention. Also, if you look at the bottom arrows, 2 arrows, the physical exhaustion starts from stage 2. So you should keep an eye on yourselves to see if any of these physical symptoms start appearing, because they appear before than other mental and emotional exhaustion in various stages. So these are the different symptoms. Obviously, I won't go through in detail. The list of symptoms is very long. Most of them are not very specific, but symptoms are related to different stages of syndrome and have been divided into different clusters. Now, this include warning symptoms in the early phase, like increased commitment to goals and exhaustion, followed by a phase of reduced commitment towards patient, towards clients, towards family, towards your friends, anybody in general for that matter. Finally, leading to reduction in cognitive performance, and then chronic sadness, chronic mental fatigue, and chronic physical fatigue and depression. So when you get these symptoms, when is it more alarming to you? When you should actually look into the things? So if the symptoms, any of the symptoms in any of the stages persist for more than 2 weeks, like persistently diminished mood, loss of motivation, feelings of guilt or worthlessness, persistent social isolation, persistent changes in the relationship for 2 weeks, life interfering anxiety symptoms, use of excessive alcohol or non-prescribed medications and illicit substances, and if there is a 2 weeks or more of a sustained decline in any function, plus changing in eating patterns or a weight loss, even weight gain sometimes is also a form of stress and alarming to saying that it could be burnout. And obviously, the most difficult and most worst situation will be suicidal thoughts and self-harming behaviors. Now, how do you measure this burnout then? There are instruments for assessing burnout. There are various of them. One is Maslach Burnout Inventory, MBI, which we normally call it as, and the questionnaire for the evaluation of burnout syndrome at work, and Copenhagen Burnout Inventory. Similarly, all those are generic instruments. When it comes to MBI, you can actually have a specific instrument for specific occupation. They have made a MBI questionnaire for physicians, for teachers, for psychologists, and also for athletes, and for school, and for parents as well. So these are the instruments mainly used, and the most common which is used is Maslach Burnout Inventory, MBI, which consists of actually 22 questions. They are divided into 3 key dimensions of burnout: emotional exhaustion, which is assessed through 8 questions. And then it is depersonalization, which is measured by 5 questions. And then personal accomplishment, which is covered in 9 questions. Altogether, 22 questions. Now, each question is rated on a scale from 0, which is never, to 6, which is every day. And then with high scores in emotional exhaustion and depersonalization combined with low PA indicates higher risk of burnout. Now, this structured assessment helps in identifying burnout levels across emotional, behavior, and also professional well-being as well. Now, coming to the incidence of burnout across Europe. In Europe, I mean, I also include UK here. And if you look at the data, it says because of the absence of generally acceptable definition of burnout syndrome, and its multifactorial origin and the vagueness and subjectivity of the diagnostic criteria, it is very difficult to get a clear picture and a correct overview of the prevalence. But even though they try to do with this different instruments of burnout measurement, and then Europe-wide data shows that it differs from between in the European Union to 10% and to non-European Union countries to about 17%. And among European Union, there is a variation about 4.3% in Finland and about 20.6% in Slovenia. And in non-EU countries, again, there is a variation from 13% of burnout prevalence in Albania to 25% in Turkey. The key insight is that higher workload correlates with increased burnout. Now, interestingly, I found this systematic review from Qatar, actually, a burnout among healthcare professionals in Qatar. Can you imagine, can you guess what number it could be compared to the European Union? Same, 17 to 20%. So it's around 15 to 20% globally. If you say it is the same, all the healthcare workers globally, at least 1 in 5 suffering from or suffered at least once in their own lifetime any symptoms of burnout. Now, the burnout in physicians. The burnout has been shown to occur in all kinds of jobs. However, the incidence is higher in physicians. In a study comparing incidences of burnout between US physicians and population control sample, Schanafelt et al. Observed an incidence of symptoms of burnout of 37.9% in physicians, where compared to 27.8% in control population. So physicians in specialties at the front line of care access like family medicine, general internal medicine, emergency medicine seem to be at the greatest risk. Now, you might wonder what are the gender differences in burnout symptoms. While most studies agree on the fact that there is no real gender effect on the incidence of burnout, but the data from the Medscape report which came, it does show some that women actually have the reported burnout symptoms are higher in women compared to men. And the symptom variation are again different there. Exhaustion and fatigue are both similar in both genders, but lack of efficacy is more common in women. We don't know why, but this is what they have been found in the report. Now, if you look at the trend from burnout trends over time in the US physicians, again, the 2020 Medscape report showed that the burnout rate is about 43% in 2020, which remains quite similar to the 46% in 2015 and 39.8% in 2013. So despite everything we know about this and a lot of research going on, a lot of awareness is happening, we are still having this prevalence of this burnout among physicians. So again, burnout is not just a psychological condition. It has significant biological consequences that impact multiple physiological systems. Now, coming to the HPA axis research, again, there is plays a crucial role in our stress response. So the chronic burnout leads to altered cortisol patterns, with studies showing about 30% variation from normal diurnal rhythms. And additionally, individuals experiencing long-term stress exhibit a blunted cortisol awakening response as well. And in addition to that, the CRH receptor downregulation happens as well, making it harder for the body to recover from the stress. Now, beyond hormonal regulation, burnout also triggers chronic inflammation, and studies indicate that burnout is associated with elevated inflammatory markers such as interleukin 6, which increase about 40% from baseline, and TNF alpha rising by 25 to 35% in severe cases. Furthermore, even CRP has been shown to increase 2 to 3 times more in people who are suffering from burnout. Now, then the autonomic nervous system also gets affected. It leads to about 45% reduction in heart rate variability, which is a key indicator of stress resilience. So the body shifts from sympathetic dominance, shifts towards the sympathetic dominance, meaning the ongoing fight or flight state with impaired parasympathetic recovery. So autonomic imbalance contributes to long-term health risks as well, including cardiovascular diseases. So understanding these biological mechanisms highlights that burnout is not just a mental health issue, it's a whole body syndrome with long-term consequences. So recognizing these physiological impacts emphasizes the need for preventative interventions such as lifestyle medicine approaches, targeting stress reduction, sleep optimization, nutrition, and also bringing in mindfulness for the parasympathetic recovery as well. So why we healthcare professionals actually are prone for more burnout compared to other occupations? Now that we got our unique challenges. we face the demands of caring for patients in complex situations, often involving trauma and suffering, and we make high-stake decision-making in the moments that impact life and death. The pressure to be consistently present and correct is immense among us doctors. And also the systemic challenges against chronic understaffing, long hours, and resource shortages only add to the mental strain, while cultural norms within the healthcare often discourage seeking support as well. Okay. So most of you must be knowing this stress performance curve. It is obviously this is a relationship between the stress levels on the x-axis and the performance on the y-axis. This is also called Yerkes-Dodson law curve, which suggests that there is an optimal level of stress that leads to peak performances. Now, we being doctor, we need to be stressed. We need to take some stress, which is called a good stress or use stress, to optimally perform. So when you're not stressed at all, you become much bored, like there is a boredom, there is no performance from you. But once you take some stress and start doing some work, even a surgeon, physician, or anybody for that matter, with a lot of interest and a lot of passion, you keep on, the more challenges come to you, more better you become performance wise. Obviously, there comes a stage when there is a zone of optimal performance. After that, whatever stress comes, it will actually take you negatively. You get exhausted, you become ill or break down or burnout or any suicidal thoughts. Anything can happen once the stress becomes more and more. So you have to identify your own zone of optimal performance at your own work level, so that always you keep maintaining that. Once you feel that my stress, what I'm putting to the work is I'm not enjoying the work and it is not actually bringing the same performance what it used to bring, stop and think where you are going, where you're heading, or you can do something about it. Now, a lot of us use the burnout and stress, both words, very commonly, very loosely, without understanding the difference between those two. So if you look at it, this compares stress and burnout. So when you compare the engagement and disengagement, stress is characterized by over engagement. As I told you, stress actually increases your performance. So it is usually characterized by over engagement. And under stress, you tend to highly get involved in their task and often to the point of overextending themselves. Then the burnout, wherever in contrast, it is marked by disengagement. When burnout occurs, individuals begin to detach from their work, feeling a sense of disconnection and a lack of interest. Now, coming to the emotional response, stress emotions are overactive. Stress often heightens emotional responses, leading to increased reactivity and increased sensitivity as well. But burnouts, if you see anybody who's burnt out, their emotions are blunted in contrast, and burnout dulls emotional responses, resulting in a sense of numbness or indifference. Now, then also looking into activity and behavior, the stress produces urgency and hyperactivity, and it tends to create a sense of urgency as well, pushing individuals to act quickly and sometimes frenetically as well. But whereas burnout leads to helplessness, hopelessness, and burnout, however, results in feelings of helplessness where individuals may feel that their efforts are futile, leading to inaction. And coming to energy levels, in the stress, it results in loss of energy. The constant demands and over engagement associated with stress can quickly drain physically and mentally, but burnout leads to loss of motivation, ideals, and hope. So burnout goes deeper, affecting not just energy levels, but also the drive to pursue those goals and to maintain a positive outlook. And then mental health impact, stress can lead to anxiety disorders. The overactive emotional state and a constant pressure can increase the risk of developing anxiety-related issues as well. But obviously, burnout leads to detachment and depression. The primary damage what stress can cause is physical. Like it can have a significant impact on physical health. Like anybody who's stressed will have a heart disease, hypertension, or other stress-related conditions. Whereas the primary damage burnout can cause is emotional. While burnout can also affect physical health, but most profound effect is on the emotional and mental well-being, leading to long-term psychological consequences. So conclusion-wise, if you see, understanding the differences between the stress and burnout is crucial for recognizing when intervention is needed. While stress can often be managed and mitigated, but burnout actually requires more significant recovery and often necessitates the changes in workload, environment, or you might need a support system. So to be simply remember, stress is when you are drained and you're able to recover. For example, if I am being anesthetist, if I'm working hard this weekend, for example, and after 2 days of working hard and stressed, if I take a rest of one day and come back to the work with the same enthusiasm and same performance on the following day after the rest, that means I've recovered. I was only stressed because of the hard work. But burnout begins when you're drained and not able to recover between your shifts or your own pattern of work. Now, this is healthcare burnout prevention hierarchy. Now, this pyramid illustrates a hierarchy of needs for preventing burnout among healthcare professionals. Now, this builds upon the Maslow's hierarchy, which you might have known, and showing how burnout prevention must start from the basic human needs before addressing higher level motivators. So foundation, if you see the foundation, there's a basic humanity which we need, physical needs and safety needs. Now, physical needs without adequate rest, hydration, proper ergonomics, healthcare workers are physically depleted, leading to stress and fatigue. Safety needs, again, burnout thrives in the environments where professionals feel unsafe, whether due to physical threats, psychological harm, or excessive exposure to any trauma. And middle layers are job factors like operations, efficient workflows, access to tools, and proper time management prevent unnecessary stresses. Then the job fundamentals, fair salary, benefits, and career progression are essential for long-term job satisfaction. Then you go higher. Higher levels are there's a purpose, there's a belonging, then the social connections and meaning. All those things come up on the higher level. So a supportive team culture fosters resilience against burnout. And when burnout is minimized when healthcare professionals find purpose in their work, not only in their work, even if they find a purpose outside of your work, it still affects you in a good way, whether through mastery, impact, or career fulfillment as well. So what is the key takeaway here? The burnout prevention isn't just about resilience training. It requires system level changes, starting from the fundamentals and progressing towards a professional fulfillment. Now, if you look at the whole pyramid, the basic humanity and the purpose and belonging, those are the components where we can change as doctors, we can change as individuals in our own lives. But in between the job factors, the occupational factors which are there, obviously the system needs changing it. We can still fight for it, we can ask for it, or being a leader, we can probably change it for our other colleagues. So majority of the times you can change yourself most of these factors. Now, there's a Stanford model of professional fulfillment. So what is the biggest antidote for burnout? It's a professional fulfillment. If you are happy in your workplace, you will never get burnt out, isn't it? So the Stanford model came out of a professional fulfillment, which has three basic components in that. One is culture of wellness. Second is efficiency of practice. And the third one is personal resilience. Now, my talk today is all about building your personal resilience. And if you're a leader in your thing, you can probably influence some culture of wellness and efficiency of practice as well. So what is culture of wellness? Okay, this dimension describes the organizational work environment, values and behaviors that promote self-care, personal and professional growth, and compassion that physicians and scientists have for themselves, so their colleagues and their patients and beneficiaries of their innovations as well. Then comes efficiency of practice. This dimension depends on workplace systems, processes, and practices that promote safety, quality, effectiveness, positive patient and colleague interactions, and work-life balance as well. Now, this is where we should concentrate. This is where we should take home message should be from here, building personal resilience. While the organization is responsible for the majority of factors related to well-being, the individual still plays a critical role. Personal resilience refers to the individual skills, behavior, and attitudes that contribute to physical, emotional, and professional well-being. So what is self-care? I mean, obviously, we're coming from a personal resilience. Now, next slide is about self-care. What is self-care? Self-care is intentional actions taken to promote holistic well-being across physical, mental, emotional, spiritual domains. This is self-care. It encompasses various activities and practices from basic self-maintenance to deeper self-exploration and growth. Obviously, the hierarchy which you have seen, you can build your own self-care plan, taking that hierarchy into your picture. It differs from pampering or self-indulgence because self-care is a necessary foundation for sustainable and effective functioning. Why does it matter? Why we should look after ourselves? Obviously, to improve physical health, because the day when you want to die, or the last day of your life, you want to be physically active and mobile. You have to have good cognitive function because there's one of our well-being things which we need to, until the last minute of my life, I need to be cognitively functioning very well. and it regulates your emotions as well, builds resilience and healthy coping mechanisms. It can prevent your work-related burnout as well. So obviously, lastly, it is a burnout prevention. It reduces emotional exhaustion and depersonalization. How can we practice self-care then? It's very easy. You have to assess your well-being regularly, pay attention to how you feel physically, emotionally, and mentally on a regular basis. Then recognize the personal risk factors such as chronic fatigue or emotional exhaustion early so that you can allow the timely interventions. And obviously, I'll discuss more specific techniques and assessment that can become part of our weekly or monthly check-ins as we go on. Then explore the effective self-care strategies cover several domains. So you can explore into different these domains. Like physically, how regular you are with exercise, how good you are in nutrition and sleep hygiene. Emotionally, accessing support networks. It could be just one friend. You don't have to have 100 of friends. One friend or a wife or a partner or anybody for that matter. If you've got a good support system and a good colleague as well, in the workplace, sometimes you need a good colleague who can support you as well, and seeking therapy if needed. The cognitively engaging in mindfulness practices and setting boundaries, and spiritually reflecting on your values and purpose. When I talk about spiritual, it is religious as well as work related as well. So in these terms, you can think about your values and purpose in that hierarchy. If you see the hierarchy of that burnout prevention, the topmost is your spiritual thing. Now, the Mayo Clinic has come out with well-being index. It has got 6 different dimensions. It actually assesses you in all 6 dimensions. About first is meaning in work, and then likelihood of burnout, severe fatigue, work-life integration, quality of life, and suicidal ideation. So this is the physician well-being index. The good thing about this index is that there are different indices for medical student, resident doctor, for attending physician, and surgeons, like separately for even for nurses as well. So there are, after answering the 9 questions in the index, individuals immediately receive an individualized score along with information how the level of well-being compares with others, and whether the level of well-being places the individuals at increased risk of potentially serious personal or professional consequences. Also, individuals are directed to a number of local and national resources that can promote well-being. Now, this index reminds individuals to assess their well-being periodically. It's just like in UK we call MOT of our cars. Every annually we to get our cars done, taken to the garage, look at the health of the car. So similarly, they do periodically this well-being index. Scores are tracked historically, enabling individuals to monitor their own well-being over time, so that individuals can make proactive adjustments in their own self-care, both inside and outside of work. While individual results of the well-being index are anonymous, the Mayo Clinic receives aggregate reports describing the well-being of staff members relative to national norms, actually by role. I mean, obviously, there are physician, resident fellow, nurse, medical student, everybody can access their own index in this. This is not, I mean, there are about more than 400 organizations which are using this, it seems, the well-being index, and with the good results. So now we have seen Stanford one, and we have seen this Mayo Clinic Assessment Wellbeing Index as well. But again, most of the doctors practicing globally in different parts of the world might not have access to all that, and how we can do it at individual levels in a simple, different way. Now, if you look at the burnout pathophysiology, there are 3 different symptoms in 3 different domains: physical, emotional, and spiritual. So your fundamental drive is the get up and go, which fueling your daily activities, your physical this thing. So your burnout can be understood through a depletion of physical, emotional, and spiritual energy. Now, physical energy fuels your daily activities, whereas emotional energy is your ability to remain compassionate, and spiritual energy is the connection to your deeper purpose, your why. Like, why did I become doctor? Why I'm doing this, what I'm doing now? So that again, these 3 things. Always you look into these 3 things, and then according to me, if you ask, and exhaustion symptoms are because of physical energy depletion, compassion, emotional energy depletion, loss of purpose, spiritual energy depletion. So if burnout often begins with physical exhaustion, as we saw, when you no longer have the energy to get through the day, this can lead to compassion fatigue. Then you struggle where emotionally to present for your patients or colleagues or family for that matter. Finally, you will lose the purpose, loss of purpose happens. And addressing all these 3 areas in physical, emotional, and spiritual is a key to preventing burnout. Then when we talk about burnout or stress, these are the three words which keep coming to us: coping, resilience, and flourishing. And they are three different words, and they have different meanings to each other as well. They are key aspects how we actually handle our adversity. Now, coping helps us to manage difficult situations, whereas resilience helps us to bounce back from that, whereas flourishing means we grow from adversity. So what we should do, include using our lifestyle medicine principles and positive psychology, is that we should aim to flourish. Just being resilient is not enough. If we aim to flourish, it will take us to a better health, to the positive health. Stress management skills, which we are taught about, like they can help with coping and resilience, but not necessarily thriving or flourishing. So as I told you, intensive healthy lifestyle, including positive activities, and can support thriving and flourishing. Here it comes our lifestyle medicine, positive psychology. Positive psychology and lifestyle medicine, they all both reinforce each other. Now, lifestyle medicine, as we all, most of us know probably here, that we have got 6 pillars where we work on, which is nutrition, physical activity, sleep, social connections, stress reduction, and avoidance of any risky substances as well. And the positive psychology, the main frame, common frame where they work on positive psychology is called PERMA model. PERMA stands for positive emotion, engagement, relationships, meaning, and achievement. If you just stick to this slide and look at all these words, if you do all these things, you should be able to prevent and also to stop burnout, and also it will lead to better health as well. So you can do so many things with lifestyle medicine pillars as well as positive psychology here. And other thing we always talk about is we should talk about the word work-life balance. No, we should start using the term work-life integration instead of work-life balance, because work-life balance evokes a binary opposition between work and life. In fact, the traditional image of scale associated with work-life balance create a sense of competition between these two elements. Instead, work-life integration is an approach that creates synergies between all other areas that define us, actually define life: work, home, family, community, personal well-being, and health. So start using this word, and this is more like ikigai. If you know the concept of ikigai, it's based upon that. And to add to it, when people talk about success, they say success is a work-life balance. But for me, it's a work, life, purpose, and passion. All three balances, all four balances actually. So keep yourself reminding what is your purpose, what is your passion, what is your work, and what is your life. Because work is just a part of life. Remember that it's not life. So lifestyle medicine interventions can be effective for prevention of burnout at many stages, and like right from primordial prevention to the tertiary prevention. In primordial prevention, it focuses on avoiding burnout risk factors before they affect an individual. Like where we can, in the key strategies at primordial level, will be building supportive workplace networks, maintaining healthy relationship with colleagues, increasing or maintaining job control, and prioritizing all lifestyle medicine pillars and engaging in self-care. All this will be primordial prevention, where you can prevent all the risk factors itself. And then primary prevention aims to identify and reduce the sources of burnout, targeting system-wide and individual-focused approaches. And then coming to the secondary prevention, it seeks to reduce the burnout severity before it significantly impacts individuals and their surroundings. The strategies could be incorporating stress management programs, promoting mindfulness techniques, and using validated screening programs, creating resources for a healthier workplace culture as well. And tertiary prevention, this aims to minimize the negative consequences of ongoing burnout or psychiatric conditions in providers. And obviously, what we can do are referrals to mental health services, employee assistance programs, and lifestyle medicine resources to support recovery. So at each level of prevention plays a role. Lifestyle medicine plays a role in a comprehensive strategy for addressing burnout. How can you prevent burnout? Very easy again. The two things you have to remember: reduce the draining activities, and then become skilled in making deposits. Those three things which I mentioned, the physical, emotional, and spiritual, consider them as a bank accounts. Each of them are a bank account for you. More you keep on using, you have to keep on filling it as well. If you don't fill, you go bankrupt. When you go bankrupt, you become burnout. So it's very easy to remember that way. Reducing the draining activities and become skilled in making deposits in those three different bank accounts. So the key takeaway is that again requires reducing draining activities and regularly investing effort and replenishing one's all those bank accounts which I told you already. This sustainable energy budget leaves one feeling engaged with sufficient reserves to withstand the workplace demands. How do you reduce drain? Again, we go into 4 different domains and see how we can reduce drain in all the different. Now, the reducing drain is a more of a primordial and a primary prevention here. So most of these things you might see duplication of the work in the both management, secondary or primary, but they're very important. So somebody who doesn't have any risk factors, somebody who doesn't have any problems with the burnout, they can still decrease the drain by physical drain by setting boundaries around the work, like whatever 40 to 48 hours productive work week. Take regular 5 to 10 minute breaks during the workday and take time to eat nourishing food and stay hydrated. Prioritize 7 to 9 hours of sleep per night and reduce emotional drain, like by setting the limits on your patient load or your workload, whatever you're doing, and then let go of the perfectionism. People try to become perfect in each and everything they do, but that actually drains you emotionally. So let go of that perfectionism and focus on good enough, and then allow others to provide care versus trying to do it all. And do not bring work stress home. Always have a buffer between work and stress. Take some buffer, like some, either soon after work you go somewhere for a walk, or go to the garden, go to park, anywhere else, or go to gym, do something else, ring somebody, family, friend, whatever. Then by the time you reach home, you're already, there's a buffering happening. Then mental drain. How can you reduce the mental drain? Schedule non-clinical time for paperwork. Create reminders for complex tasks. Clear your email or inbox regularly. Reduce multitasking. And then spiritual drain. Make time for inspiration and meaning. Rediscover purpose behind career choice. Foster self-compassion on tough days. This is spiritual is the thing which we always think, okay, once I retire, I'll do these things. Don't think that way. As I told you, the success is a balance of like work, life, passion, and purpose. All 4 things to be done every day, every moment, so that it actually buffers everything else which is negative towards you. Second part is increasing or regular deposits into those 3 bank accounts. How can you increase regular deposits into physical bank account? Is again exercise, nutrition, take short movement breaks, again movements, then prioritize sufficient sleep. Then emotional, spend enjoyable time with friends and family. Always keep time for them. Pursue fulfilling hobbies like art or games, anything. Schedule regular date nights with partnered, or spend your time with the family, wife, children. Volunteer to increase a sense of purpose. Even if you volunteer for 1 or 2 hours in a month, with doing something where you are not expecting anything at all from back, that's like a charity work, it's still you can increase your emotional deposits. Then increasing mental deposits, read literature or listen to podcasts or read other books or anything which interests you. Then take educational courses, try something else, try learning something else. Have focused conversation without any distractions. Practice mindfulness and meditation. Spiritual deposits, how you can increase, cultivate a sense of meaning in your work, foster self-compassion and gratitude, spend time in nature, develop spiritual rituals like prayer, yoga, whatever suits you, to your religion, to your culture as well. Now I'll go through some evidences on these lifestyle medicine pillars which have been shown for burnout, which have been shown impactful for burnout. So diet is a modifiable factor when it comes to burnout. You can modify more better diet becomes you are better with the stress and burnout. The chronic stress often influences our eating habits as well, and a poor diet can contribute to burnout. Research supports that healthy eating, particularly the Mediterranean diet, is protective against burnout. And key nutrients like omega-3 amino acids and complex carbohydrates all support brain functions, which helps to prevent burnout. And mindful eating interventions are needed, especially for emotional eating. Somebody who's in chronic stress and they keep on eating, this is where the weight gain happens as well as a symptom. Now let's briefly look at a study conducted in 2015, which involved 630 female employees from municipal work units in Finland. They used burnout indicator, and they measured burnout and assessed their diets with a food frequency questionnaire. Now the key takeaway was diet plays a significant role in burnout, with healthy eating being more protective. Now coming to physical activity pillar, it's another major factor in reducing burnout. Strength, like aerobic strength, flexibility, and balance exercise all have benefits, but a systematic review of 10 studies found moderate to strong evidence showing that physical activity helps reduce exhaustion, which is a key component of burnout. Now, incorporating regular exercise into your routines definitely an effective way to combat burnout. Then stress management techniques. To manage stress effectively, there are physical, psychological, and social techniques we can use. The physical techniques include deep breathing, muscle relaxation exercise, healthy eating, and getting enough sleep. On the psychological side, mindfulness meditation, cognitive restructuring, and reframing negative thoughts, they're all great tools. Even humor and laughter can help regulate emotions during stressful times. And then the social techniques, obviously, venting or talking to supportive contacts, seeking counseling, building social connections, volunteering to help others, also have been shown to be protective. And professional techniques like setting priorities, breaking down large tasks to smaller tasks, and taking breaks, and daily practices like morning stretches or a walk, nature breaks, writing a journal, maintaining a work-life balance or a work-life integration rather. Another well-being intervention is spending time in nature. Make sure that you live or work near natural settings, plant life, etc., or set regular time to spend in these settings. The physiological benefits include lower blood pressure, heart rate, and cortisol levels. Also, mental health and emotional health well-being are boosted. Now, this meta-analysis of 103 observational and 40 interventional studies has shown that green space exposure is associated with decreased cortisol, decreased blood pressure, decreased improved HRV, and also the decreased type 2 diabetes and CVD mortality and all-cause mortality as well. How much time you have to spend? A single 90-minute walk in natural setting versus an urban setting decreases in rumination, often found in persons with depression and other mental illnesses. A 60-minute walk with improved physiological mechanisms, reductions in diastolic blood pressure, heart rate, and cortisol levels. So any walk, for example, don't go on the research studies and numbers. Any exposure in nature is better. However time you can spend, just go along and spend it. Again, there's another study showing that spending of at least 120 minutes a week, 120 minutes a week, not one day, a week in nature is associated with good health and well-being. So its likelihood of reporting good health or well-being became significantly greater with contact more than 120 minutes, but compared to no nature contact. This pattern was actually consistently seen across groups of older adults, people with chronic health conditions as well. So even one long versus several short visits per week are equally beneficial. So if you think, oh, I can't do 120 minutes, but even if you do 10 minutes every week, every day, in 7 days, you're still getting 70 minutes, not bad. But if you increase it the following week, and increase by 5 minutes, in the following week, another week, you can increase another 5 minutes. So you will reach to the target of 120 minutes. Once you reach, keep doing it. You can do more, but even if at least do 120, it's good. Now, coming to sleep one, obviously, the National Sleep Foundation recommends that adults should get 7 to 9 hours of sleep each night. However, nurses and other healthcare workers who get less than this are at higher risk of burnout. And to prevent burnout, keep your sleep that low, stick to a consistent sleep wake schedule, and build a buffer between work and sleep with a relaxing wind down routine. Now, mindfulness-based stress reduction as a stress management intervention for healthy individuals. There was a systematic review of 17 articles. They concluded that it appears to be a promising modality for stress management. Now, coming to PERMA model, as I told you, PERMA actually is a part of the positive psychology, and it does stand for positive emotions, engagement, relationships, meaning, and achievement. So if you engage in all these things, practice gratitude, find activities that fully absorb you, cultivate supportive relationship, ensure your activities align with your core values, and celebrate some small accomplishment as well. They all help you maintain the well-being and prevent you from being stressed or even burnout. Now, although the existing evidence for the contribution of positive psychology, most interventions show some positive outcomes in reducing burnout or improving well-being. But they also say that system-directed interventions like organizational changes are more effective than individual-based approaches. Now, to implement PERMA model, you can start with 3 simple tools. The first one is reflect on your days, like 3 good things to boost happiness and emotional recovery. Second, write a gratitude letter to someone who has positively impacted you. A letter could be email as well. It improves the well-being for both you and for the recipient as well. And finally, take time to reflect on your future aspirations to cultivate optimism and emotional thriving. So to conclude, a healthy lifestyle with 6 pillars and PERMA can increase physical, mental, emotional, social well-being to combat burnout. The take-home message from me is intense lifestyle change has the potential to help us go beyond resilience towards positive health and a state of anti-fragility and to thrive and to survive. And you can build a self-care plan today that can harness all of these elements. Sit down, go back home, sit down, look at the 6 pillars, look at the positive psychology activity and see where you stand and try to improve small things in each of the pillar. You don't have to improve everything together from tomorrow, but you can increase something. For example, go and see nutrition. What am I doing? How many meals I'm having? And each meal, how healthy it is? Am I drinking enough water? Just these 3 things, question yourself, go home and sit down. Okay, I'm drinking very less water. I have to start drinking more water from tomorrow. My plate doesn't look that healthy. So let me start by changing at least a quarter of the plate healthy to start with and then increase it. So slowly, once you start putting this, audit yourself every month and see how you're doing. Some references here, which I have not mentioned on the slides. And thank you.
All right. So, Dr. Sunil, absolutely an amazing discussion. Very rewarding in a variety of ways. And I was just fascinated by your comments on certainly prevalence. I didn't realize, I mean, physicians 40%, but other healthcare providers, 1 in 5, I would imagine, is what you said. The point that it affects the entire body, not just the mental health, is an important one. It's a global effect that burnout has on your body. And the distinction that you made between stress on the one hand and burnout on the other. And I was thinking from a clinical standpoint, obviously, for many people, you may be between the two, if you will, because some of us, our personalities are such, we don't know we're dealing with stress and or we are dealing with burnout. But I think in your remarks, you made that point, but also for us to recognize, and you would agree, that there may be an overlap, and sometimes it's hard to know. I also liked your comment about the work-life integration, and I think that was remarkable. And then your comment about the drain and the deposits. So thank you so much. This was wonderful. A lot of comments in the Q&A and remarks section say, great talk. Thank you, Dr. Sunil Kumar. Your points are well taken, and they're appreciating the remarks that you made in such a short period of time.
Thank you.
That being said, there are a couple of comments and questions. So if I have your permission to
Yes, please.
proceed with
Thank you.
those. The first thing is, I mean, you've said this. We work in situation where there are several of us. We know each other. We know colleagues. What is it that you would say to employees such as myself or anywhere else? Couple of 2 or 3 things that might tell someone, wait a minute, there is a burnout happening in this person. I know you describe the details of the symptoms, but if I had to pick 2 or 3, this is what the question implies. What is it I'm looking for in myself or somebody who I know, who I love as a friend, who I care for? Perhaps I might say to him or her, hey, wait a minute, there may be something going on. Can you comment on that, please?
Yes, thank you, Dr. Ravi. It's a lovely question and a very favorite question of mine as well. The first thing, if I'm doing, I'll tell you from my point of view. I know myself. I think everybody knows ourselves, themselves much better than anybody else. So you know how much passion and how much optimism you have when you go to work every day, and the performance you actually create for the day. Now, if you notice any difference in your with the same persistent efforts, you are still not getting the same results. And if you notice some emotional changes or a physical changes for the same work which you were doing earlier, and that actually gives me a red flag. I sit down and assess myself. Is something wrong with the system, or is I'm not in a new environment, I'm not in a new profession. I'm not with the new people, but something is definitely affecting me here. So I have to sit down and see, am I working too hard, or am I putting myself into my deposits are getting depleted where I have to go and make more deposits? This is what I feel. And similarly, if I see a friend whom I know can do, my colleague, my friend as a friend at work, I mean, again, I know how good he is, how everyday performance he can bring it to the work, and how much he can contribute. If I see some differences, I will definitely sit down with him and speak to him. Is everything okay? And this one thing will change for them to sit down, because we're all in a rat race. Nobody sits down and think, is everything right? Like we're all running to the same thing, but there might be different way to run. You can still reach the same destination, but there might be different way, different path for you, for your own circumstances, for your own skills, for your own whatever you want to gain in your life. So there is something, but we won't think about it unless we stop.
Yeah. And I totally agree. And thank you for sharing that. That's extremely helpful. And just picking up from what you said, I think it would be helpful that for corporate entities to actually engage in discussions with employees, such that they can help themselves, but
Yes.
also that they can help their close friends or colleagues in a work situation. That to me
Yes.
could also be very important.
Yeah.
So thank you
You
for
can
that.
you can have a well-being champion in each department.
Yeah, absolutely. Yeah.
Yeah.
And I totally agree, without, of course, intruding into somebody's health life, if you will, because health is a very personal matter. There are people
Yeah.
who hold on to things themselves, and that's okay. But
Yeah.
also, there are some individuals who are open,
Yes.
listening to you or to a friend.
Yeah.
And I totally agree. That great point. Here is another very important question, I think. We think of burnout as something that relates to your occupation, your workload. And this great question has to do with the fact, but there is also a personal life that we all have. You have a personal life, I have a personal life. I mean, homemakers have a personal life, and so is there a concept of burnout among, for example, homemakers, people who are at home helping? Men and or women. There are women who go out to work, and there are men at home who are helping, doing household things. That's fine. Depends on the agreement that the couple has.
Yeah.
But could you speak to that about the burnout among people who are at home? Is
Yeah.
that a burnout? Is that stress? Or can you embellish on that? I don't know if I'm asking the right question. And
No,
in the
no, I think I do know it is a right question, and I do understand where it is coming from as well. Obviously, if you look at the definitions from WHO and everything, it's a occupational related syndrome. Now, for somebody who's a housewife or a house husband, for example, where they're a homemaker, their main work, if you call that as work, is to keep home in order, and also to look after the family. So it's occupation for them, if you see that way.
yeah,
And there are emotional components, there are physical components there as well, where they get tired, sometimes they get emotionally drained. So obviously, if you look at all the criteria, you can still find those symptoms, those stages in them as well. So this is where obviously I do understand, I do agree they do suffer from
yeah,
burnout as well, a really defined burnout. Even if you
yeah,
put them to the scales of the marker of burnout, you can still get those points where it's suggesting of burnout in the longer term.
yeah,
For them, prevention and training activities where other spouse or other partner has to go and help them as well. So that might take away something off. And plus, they have to decide themselves, they need a break as well.
yeah,
And we do as a professionals, we might get some annual leaves and off, but obviously homemakers don't get that. And
yeah.
this is where we have to help each other and probably do that, I guess.
Thank you so much. Very helpful indeed.
Thank you.
There's a comment about reducing work hours, and if there's a place in our work situations where reducing number of hours might help. I mean, I'm not saying we should or we should not. So no implications in terms of for listening to me from Weill Cornell Medicine in Qatar, but I don't know. Have studies shown that reducing a number of work hours would reduce it, and or I don't know. Any comment on that?
Yeah, I'll give again my personal example as well. Now, about 6 years ago, I was a full-time anesthesiologist working in
Yeah,
intensive care and night days, nights, and everything. I had
yeah,
reached to a stage of burnout,
yeah,
really.
yeah,
And this is where I mean, my health was not in good order. I
yeah,
was 27 kilos more than what you can see me now.
yeah,
And everything was upside down, very irritable at home, at work, everything. So this is where I stopped. I stopped and reduced my hours
yeah.
from this thing. Obviously, we have to know how much money is a big important factor for all of us. And
Yes.
we should understand, we should define where we can cross, how much we can cross. Like, is it possible? Do you want to trade in your health to finance, or you want to get a balance of those two? And how much work you can do to maintain
Yeah.
what you really want to do? For me, work is part of life. Now, currently, I'm telling you, I work 60% of anesthesia and 40% of lifestyle medicine. In that lifestyle medicine, it has changed my life. Doing
Yes.
less, getting less money has brought me much more wealthier life.
Yeah.
You can say that.
Mm.
And I got more time to myself, more time to family, and
Yeah.
I'm more happy all the time, and more optimistic as well. And plus, I'm doing something for the community or for the people around me and all that. So
Yeah.
I feel if you think that is really affecting you, either you can change the job. Sometimes change of place, change of people managing you will reduce your symptoms.
Mm.
Or if you want to stay in the same place, same people who are managing you and same organization, then try to see if you can take a little bit work hours down if you can. Obviously, I can't suggest or I can't say you have to. Uh, this is my suggestion because personally, I have seen reducing those hours, changing specialty like anesthesia to lifestyle medicine. Even though I work full time now together, if you put together, but I have got more in that less, if I can say. So,
Yeah. Yeah.
thank you.
I think the word is finding that optimum happiness in terms of
Exactly.
our workload and situation. And I totally agree with that. There are a couple of other questions, but I think you've answered them in a variety of ways. And I know it's well past your time. Um, and so I just want to say thank you. You've been absolutely amazing.
Thank you, Dr.
Um,
Mantani. Thank you.
and we will hopefully inshallah, get
Inshallah.
you back to talk more about some of this or even issues related to burnout, stress, and lifestyle medicine. Some of the points that you made also apply to self-care, and you use that in terms of building your health, not necessarily related to burnout, but to your well-being. So with
It's a,
that,
it's it's a, it's a broad spectrum pill.
yeah, it is a broad spectrum pill. Yeah, and that's what I've said. If this lifestyle medicine or even physical activity came in form of a pill, it'll
Yeah,
be probably the hottest selling pill on this planet.
on this planet, definitely agree.
But what can we say? There are commercial overtones associated with healthcare, and I will leave it there. Otherwise, I'll keep going. So,
No disclosures.
so once again, thank you so much.
Yeah,
And we are grateful to you. And on behalf of IPH, Weill Cornell, we express our gratitude to you and for taking the time to be with us this evening. So, and I want to thank the audience.
yeah.
Great comments, a lot of appreciation. Thank you for you, Dr. Sunil. And I want to thank each one of you for attending it.